Good evening. I'm Dr. Louis Fetter, cosmetic dermatologist and surgeon, practice in New York. Thanks again for joining us for our weekly show on beauty and fashion and health and cosmetic surgery and all those wonderful things you at home want to know that we're going to tell you. This is our second season, and I'm glad you've been supporting us at home, because without your input, we wouldn't have half as much fun doing the show for you. Tonight, we're going to discuss a very, very unusual subject, because everyone has questions about it. I'm sure you have thousands. We're going to discuss hair tonight. What hair is, why you lose it, why you didn't choose the right parents, all the wonderful questions that you really have. We're going to try to give you some insight. And we have two very interesting guests. To my left is Dr. Irwin Lubow, who's a prominent dermatologist here in New York. He's a former professor at the New York Medical College and is in private practice. Irwin, good evening. Thank you for joining us.
Nice to meet you.
And to the doctor's immediate left is a very prominent man who comes to us from England, who has a clinic here in New York, Philip Kingsley, who has also written several books on hair and is a trichologist. And he's going to tell us what a trichologist is and what he can do and how he works with doctors and all those kind of things. Philip, also, thank you so much for joining us tonight.
Thank you. Nice to be here.
Philip, I'm going to start with you first because you're at the end, so it's easier. I can get the questions all back this way.
I was afraid of that.
I thought so. What is a trichologist?
Well, it's a person that specializes in scalp and hair care, and I consider that I'm sort of halfway between a dermatologist like Dr. Lubow and a hairdresser, and I'm the sort of person in between. The hairdressers send me people, and if I can't handle them, I would send them to a dermatologist or another doctor. But I'm concerned mainly in health of the hair, health of the scalp, having it look as good as it possibly can look, not having people sort of scratch on their scalp all day and things like that.
Well, as you know, I'm a cosmetic dermatologist also, and I see that. But how would you differ from me? You don't have a medical degree, we know that, but how can we work together?
Well, first of all, so many hair and scalp problems are metabolic, as you know. And if I can't handle the metabolic problem, I would send them to a physician to do so.
I see.
As far as the external problems are concerned, like somebody would come to me, for instance, they say, my hair's looking terrible. It's looking dull, it's breaking off, I've got dandruff, it's falling out, and some things like that.
Well, I hear a lot of that stuff too. You may get them all. I mean,
I get them all. Everything.
Well, so do I. Tell me, Dr. Lubow, how important do you think heredity is in hair problems and hair loss?
Dr. Peter, there are various types of hair loss. The most frequent type is the male pattern baldness and female pattern baldness. In those cases, heredity is the most important
So
factor.
you got to choose the right parents straight out.
Correct.
I see. But tell me, that's a real problem. I'm working on that. So that thing.
Lucky I did. Actually, I didn't, because my father was bald, actually.
Oh, my. You know, here I was ready to invite us all to Sweden to get the prize, and now you went and blew it.
Sorry about that.
Can I ask Mr. Kingsley a question?
I can't see why not.
What are your educational qualifications, and where did you get your training, may I ask?
Well, there's an institute of trichologists in London.
And there's one in London.
Yeah,
And you studied in
there, yeah.
at the
Founded in
institute.
1902.
Good. Now, I have something interesting here. There's been some very new major work that I know I've been using in my office, and I know Dr. Lubow has been doing, for female and male pattern baldness. Tell the audience some of this newer work that we've both been using that has been so interesting and so very helpful. It doesn't make hair grow back, but I've seen in my patients, I know you've seen in your patients, it has definitely decreased the losses of hair in both men and women.
Yes, that's very correct. We're referring to an entity that's called male pattern baldness and female pattern baldness, in which the cause is genetic and usually inherited from male or female, mother or father, and there is an increased amount of testosterone, which is the male hormone. And originally, work in this field was done in Germany about 6 years ago, where a product called cyproterone acetate
that was not approved in this country, of course.
No, it's still not approved.
Not FDA approved.
Because there are many side effects.
Yes.
As enlarged breasts,
and liver,
loss of sexual desire, and
we don't want that.
No,
That's in New
absolutely
York City.
not.
That's very dangerous to even mention that. Murder.
Well,
I mean,
that-
a man can have hypertension and tell me he has to take a pill that'll decrease his sexual appetite. He said, I'd rather die.
That's correct. Well, anyway, I learned of this original use of cyproterone, which neutralized the male hormone, and I studied the various medications available in the United States, and I found...
And what did you find? Tell us.
I did find that
All right.
spironolactone, which is the generic name, or aldactone, taken by patients suffering from this entity, taking 1 pill a day, 25 milligrams, in a matter of 4 to 6 weeks,
Yes.
the hair fall would return to normal.
Well,
and as you mentioned, there's no hair growth, but it stops
You
the
will
hair
stop
loss.
it. But of course, we should mention to the audience that before the doctor would do this, or I would do this, we get some very basic blood parameters, blood count, we get special hormone levels, and from there, we go on. In addition, I know, we discussed this, in fact, before the show, many of us and many of the people doing a lot of work with hair, we have been using also the injections of both the progesterone, which is also anti-androgen, which is another hormone, which is seen mainly in women, but it has a very good anti-androgen effect. Now look, we don't want to put you to sleep, and if you have any, if we're getting too heavy, please call, because I think this stuff is still very, very important. So basically then, are we not using the same therapies in both men and women for this pattern loss?
We use the identical therapy, except that we use a topical lotion in the female, which contains estradiol, which is the female hormone. And in the male, we do not use the estradiol.
Estradiol meaning estrogen, which is the main female
and we
hormone.
just use progesterone. Now, when the patient comes to the office complaining of hair loss, we take a complete history, and then we examine the patient, take the blood pressure, the pulse, and we comb the hair to see if there's a lot of hair
Wait,
fall.
you're taking away his job.
No,
Now,
he could do it.
No, that's,
do you comb the hair too? Do you comb the hair?
Yes, I comb the hair. I put some cotton wool, or cotton as you call it here, in the comb it through and take samples. But what is an interesting fact, which neither of you have brought up, because you're not aware of it, is that I'm going to make you aware of it, absolutely, that's why I'm saying it. But I've been involved in a research project in England for the last 3 years with Dr. Mortimer, who's an endocrinologist, one of the foremost in England, and Dr. Jilks, who's a dermatologist, and Dr. James, who's a pharmacologist. And we've been doing research on male and female pattern alopecia. And we've come up with some extraordinary results on it. We've also come up with something called a trichogram analysis, which has been going on for quite a long time, but we've perfected the technique that we can now measure exactly what type of hair loss a person has, because often, as you no doubt know, and you've had patients misdiagnosed, and they've come to you and say they have male pattern, female pattern alopecia, and in fact they haven't. They may have traction alopecia or something else.
Or trichotillomania, where they're pulling their hair out too.
Trichotillomania,
Sure.
or hair loss due to other metabolic disturbances. With this particular trichogram analysis, one could, definitely
Pinpoint it more.
exactly what type of hair loss it is. It also pinpoints whether there are any metabolic problems. What we've also discovered, interestingly, is that men have more hair on their head than women by a great percentage. The number of hairs per square centimeter of men are 311. Of women, it's 279. Everyone used to think that women have more hair than men. That's not true.
You're quite correct about that. The problem is we have those bloody hormones that are circulating, giving us the problem.
No, it means that men have finer hair than women.
No, but I'm saying the reason
picture.
men have more of loss than women is because of the effect of the hormones and of heredity.
But, the interesting thing, though, what I'm getting at, is that the hair follicles, contrary to what the public think, don't really die. It's just that they shrink, they become atrophied. The hairs they produce become smaller and smaller and shorter and shorter. And we know that when a hair has reached a certain diameter, it only grows to a certain length.
That's true.
May I interrupt? Usually it's a half inch per month. There are 105,000 hairs in the blonde scalp, 100,000 in the brunette, and they're...
The redhead has the least.
That's correct.
That's right.
That's right, it's
I
true.
just thought I'd bring those figures up.
Listen to me. What are we going to tell the people at home about mechanical factors that they can do in their own home to minimize the trauma and the damage to their own head so they can at least, when they come to us with a problem, they can at least have those factors minimized to begin with.
So pleased you asked me that question.
I thought, all right, first I want you to give me 2 sentences, and then I'm going to my good friend, Mr. Kingsley.
Well, I must say that I've been doing this work for the past 50 years, so I've had little experience in the treatment of hair disorders.
Would you wait just 1 second, though?
Yes.
I have a message for the audience at home. So no one go anywhere. Stay right in bed. Keep doing your push-ups and exercises and sit-ups.
What is in bed?
Of course, it's a late hour. Be right back. Don't go away.
You know, growing up is tough. For kids to make it, they need a fighting chance, like the one I got at the Boys Clubs of America. The Boys Clubs stay open to give kids a place to go and a chance to make friends. The clubs are run by trained adults with a lot of heart and time to listen. I'm glad I had a Boys Club, and so are 1 million kids today, because growing up is still tough, and kids don't have a fighting chance without a good club.
Now, doctor, before I just interrupted you for that little message, you have these wonderful thoughts, these pearls that you're going to give the audience right now about certain little things that they can do at home to minimize trauma to the scalp and to the hair. You're on.
The most important factor in the destruction of the hair and hair loss is the use of a hot blower after shampooing the hair. The heat destroys the hair follicle and hair shaft. So we say that it's absolutely necessary not to dry your hair with a hair blower. Secondly, they must not use a brush with stiff nylon bristles.
Natural bristles.
Yes, they must use a natural bristle. They must not use rollers, no permanents.
Well, that's 3 now. Those are 3. We have to have my good friend Philip Kingsley. So now 3 for you.
Well, 3 for me. Well, there's a lot more, actually. But at the risk of slightly disagreeing with Dr. Lubow, a hairdryer doesn't really harm the hair if it's used correctly. If it's over-dried, it's fine, first thing.
Right.
Second thing is hard brushing, of course, is very dangerous because it pulls the hair and breaks it off. On the other hand, from styling purposes, and one's got to look at it practically, because when I first started doing this, I used to tell women and men, don't do this, don't brush it, don't perm it, don't colour it, don't bleach it, don't roll it.
Then you never see them again, either.
You never see them again, because they go away and they do it.
You ruin their lives.
And then in 2 years' time, they come back with their hair in worse condition,
Yes.
but then you temper it.
You must
say,
work in the patient's
do it.
lifestyle,
Yes.
exactly.
Do it,
Yes.
but be careful.
That's
If you
right.
want to colour it, do it. If you want to perm it, do it. If you want to brush it, do it gently.
That's right. Moderation.
Exactly.
That's
But
the
then
key.
you have to compensate by doing the other things to undo the bad that all the chemicals do and all the
correct.
physical harm does.
Like swimming in a swimming pool, for example. I mean, chlorine is
right.
murder.
Terrible.
If you go into a sauna, it's murder. I always have my patients put my conditioner into the scalp before any of those things.
That's right.
But I also say, as we were talking about the hair dryer, if a patient must dry the hair, I always suggest keep it on warm, never hot. Keep it at least 8 inches from the scalp and constantly keep it moving.
That's right.
Keep it doing it enough until you've styled the hair, then let it air dry. You won't
If you leave
traumatize
it,
the hair.
that's right. If you leave it
do that.
slightly damp, it's fine.
And how do you both feel about conditioners, the use of conditioners in the scalp?
Oh, I think it's essential. I think
Daily?
Absolutely.
I suggest that also to my
I think
patient.
the hair should be washed daily, and I think it should be conditioned daily.
I agree with that. Doctor, how do you feel about conditioners?
I think the protein conditioner, the hydrated protein is excellent. But I disagree with Mr. Kingsley on daily washing of the hair, because we do not suggest it more than 2 or 3 times a week, because
Now wait, are you talking about damaged hair or normal hair?
normal hair, because the average shampoo is either a soap or a surfactant.
That's
and
the
it's
average
alkaline.
shampoo. Okay,
yes.
if it's a good shampoo though, and it's well prepared and well formulated, I believe in the normal head, it's easily to shampoo every day. I've been shampooing my hair now for the last 30 years, every day.
Well, I must say it looks very well.
Thank you.
Thank you.
I'm using Dr. Fetter's shampoo when I was 5 years old. I first formulated it. I knew it
Well,
was
I've been
going to
using
work.
Philip Kingsley shampoo, you see, and I've been using it. I mean, I'm not as old as you. I know I have. But
I thought you
I've
would
been
say that.
using
You
it.
promised.
The reason I object to his shampoo is not only because of its alkalinity, because of its traumatic effect. By rubbing in the foam into the scalp, you're going to pull hair that are loose out of the scalp.
Well, if those hairs though are going to fall anyway. If they're that loose, they're going to fall.
That's
And
correct.
I think if you're being very abusive with the scalp, that is wrong. But if one is careful and just washing the
If
hair
you're
for 15 seconds, that's not going to hurt it.
So if you consider as well at the end of the day how dirty your face gets,
course.
and you take your hair usually to the same places.
Absolutely. It usually comes along.
Usually
your
goes
hair
along
is
with
there.
you anyway.
I know your face in the evening when I cleanse my face at night. I have a regimen which I give my patients and to myself where I do my cleansing bar, follow that with my peeling astringent. I see what comes off my face at night,
That's right.
and it's incredible. And it must be in the scalp. Otherwise, your
Exactly.
scalp will itch, and it'll look miserable also if you don't wash it. In New York, at least, every day.
And also, clean hair looks healthier. It looks better.
Fuller
it looks
and-
bouncier and
right.
fuller and shinier. I mean,
To
depending on
sum
the
it up,
shampoo.
one must use a gentle shampoo with gentle rubbing.
Good.
Perhaps
Now
that-
we're all of the same mind. I feel
That's
much better. Now, what role do you think nutrition plays? As you know, I'm very big on nutrition. I dispense vitamins to my patients, and I know you very much believe in that also.
Yes,
One thing I
I
always
do.
do is avoid vitamin E in my women who have hair loss because I find that it causes more. But how do you feel about, in addition to a good diet, do you believe in vitamin supplementation?
Absolutely. I am under the opinion of using small doses of vitamin A. One should not use more than 25,000 units of vitamin A or beta-carotene. One should use the B complex with all the combinations of the B vitamins, usually either 50 milligrams or 75 milligrams.
Or a B and C complex, you mean, something
All
like that?
combinations.
Right.
And then we suggest calcium pantothenate, inositol, choline, and trace minerals. It's very important to use trace minerals.
Selenium
in
and zinc
conjunction.
and things like that. Very
That's
important.
correct.
Absolutely.
In conjunction with the B complex vitamins.
Iron is very important.
How about the things you've done? I know you've done a lot of work also with some other people in nutrition.
Yeah.
Do you advise your patients about buying these things and taking
Oh
them?
yes, very much. I'm a great believer in brewer's yeast, for instance, which is vitamin B, and in defatted liver with B12. And in our research in England, we've discovered, or we've coined a phrase called carbohydrate anorexic alopecia, that we've discovered that women particularly that go on very stringent diets that don't eat carbohydrates and they only eat protein and drink some water because they want to keep their weight down, lose their hair. Their hair thins and thins and thins. And at first we couldn't understand it.
Well,
of course, we used to
it's
think
interesting.
that lots of protein was good. Well, it is good, but you've also got to have complex carbohydrates.
Well,
for
there
the
is
hair
an
follicle.
entity called crash dieting, which does cause hair loss.
Absolutely. That is known. Taking the birth control pill can cause
Yes.
it. And as you know, there was a condition seen during the World War II called kwashiorkor, where patients would just stopped eating, and of course they lose their hair, because
Of
people don't
course,
realize,
yeah.
even though the hair itself is not living, the follicle is. And if you don't give it the proper nutrition,
That's right.
like any other organ, and don't forget also, the hair is one of the fastest growing organs. The turnover is so rapid.
Absolutely, and it's,
So it needs a lot of nutrition.
yes, it's a part of the body that is affected by everything and is faster than anything.
Now, I know you do some massaging at your clinic. Do you really think that is that helpful as far as increasing blood flow, the local effect of it?
Well, local massage, first of all, is wonderful. If
Oh,
it's
I
done
love that.
correctly,
Listen,
it's lovely. The fact that
Better
you
than
love,
sex, I mean,
you know,
it's the greatest.
Well, I wouldn't quite say that. I wouldn't quite say
Relaxing.
that. That depends. But the relaxing effect is terrific, and the feeling of well-being that massage gives you actually helps your hair, because so many types of hair loss are due to stress.
Right.
And if you get them relaxed for 20 minutes
That's
or
a
half an
great
hour,
idea. I'm glad you mentioned that, because, you know, very, very few people really remember that the skin, hair, and nails come from embryologically, come from the same ectoderm. So if your nerves are frazzled,
Absolutely.
very often your hair will be the same way.
Sure.
Hair and the nails. yeah.
Skin, hair, and nails. Ectoderm is one of the parts of the embryology which give rise to these parts of the skin and skin, hair, and nails. So
Of course, you have to massage it correctly. So many people sort
how
of-
does one massage correctly? Do you think?
Well, you've got to move the scalp. You have to knead it. Not rub it like that,
No, I
but
see.
lift the scalp.
Like
from,
making some bread,
like making
the
bread.
dough.
You lift the flesh from the scalp.
Any of your friends who want to practice, you can call me anytime, because I love that.
Terrific. I know you only want girls to practice on you.
Now, do you believe a tight scalp contributes to hair loss?
I think that people under stress usually have a tight scalp.
That is probably
and
true.
I think that it's the stress rather than the tight scalp.
I think people who relax on vacation, it'll probably loosen up a bit.
Yes, and of course, it's a fact that people are much happier during the summer months, for instance, or when they're away on holiday during the sun, or even if they're skiing and they're relaxed, their hair is generally better. And this time of year, sort of in winter
Well, again,
time,
there you are with stress, the point of stress being so very important. And I think if you're putting a patient at ease, that's why when patients come to my office, I keep it with nice, soft lights and low music and make it as lovely as I possibly can for them, because I find when I treat them, they come to me much more easier to treat, in a much better frame of mind, and I feel better, because I always have music around, and I have girls serving coffee and tea from a very pretty sterling silver cart, and I try to make it as pleasant an experience as possible for whatever the problem is. And I find...
Is that after you collect the fee or before?
Well, everyone got to pay a fee. You go to you'll pay the same fee at sitting at the well-known hospitals on a hard chair for 6 hours, or you can pay a fee to me and sit there for 45 minutes on Fifth Avenue. Whatever you want to do, it's up to you.
Well, I'm being facetious.
I know that.
But
I've only known you since the flood, so you can pick on me, you know.
I'd like to ask Mr. Kingsley a question, which is very important. What do you feel about excessive exposure to the sun does to the hair without being protected?
I think it's terrible. I think the hair should be protected by the sun, and I think, in fact, I'm coming out. I've just made a group of products called Sun Survival that are used for the hair.
I think it's a very good point.
To screen the ultraviolet.
In the summer, I make sure my patients always put some of my conditioner into the scalp when they're sunbathing, when they go in the ocean, and after. I think it's very important.
It's important.
And if you're going in a swimming pool with chlorine, which is very damaging to the hair,
That's right.
it is essential to put it in before, wash it out almost immediately after you finish swimming, and reapply conditioner. The sun, heat. If you're going in the sauna, for example, essential to put some conditioner into your scalp, into your hair, and to moisturize your face.
Of course, and if it has a sunscreen in it, so much the better. So it screens out the
I agree
ultraviolet.
with that.
All right, maybe we should also mention some of the metabolic problems that can cause hair loss. For example, venereal disease, which no one gets anymore, it's so boring, can cause hair loss. Thyroid disease, hypothyroid disease.
Sure.
It's even seen in certain diabetics.
Oh, yes.
Where else have you seen hair loss? What other
It
medical
occurs
conditions?
in people who take certain drugs, like drugs used to treat cancer.
Well, that's pretty well.
Nearly all of the patients lose hair.
The anti-metabolites, yes.
But it's only of a temporary nature. And then there are drugs that reduce cholesterol, drugs that coagulate the blood, like
heparin will cause it too, yes.
So one must be careful. And diuretics do that too.
Diuretic meaning the water pills.
And of course, anemia, iron deficiency anemia.
Very common. As a matter of fact, almost all my patients get a blood profile because anemia will classically cause it. Of course, if after anemia, probably thyroid dysfunction is the next most common cause, after basically heredity. Now, we both, all three of us are of the mind that the hair loss can be controlled. I think we should also mention the fact, just to put it down where it should be, that hair implant, which is such a terrible thing and caused so much harm to so many people. This is not to be confused now with a hair transplant, which is basically a graft, which I've been doing for well over 10 years.
And which human hair, yes.
Yes, of your own hair. In other words, you're moving hair from one area to the other, and that's either with a punch graft, or you can use a flap. The flap has a bit more morbidity, it's a little more painful, it's a lot more involved than the punch graft technique, which is certainly an excellent technique. Now, there's also the hair weaving. Have you had any experience with that?
Dreadful experience.
I agree with that.
Absolutely awful, because it causes scalp irritation. They have to weave the hair very tightly.
Explain how it's done for our audience, won't you?
Well, what they do is they take the hair that you have, and they have sort of thread with hairs attached to it, and they weave it in between the hairs.
To what you have left,
To what you have left,
Exactly.
and it's attached to that very tightly. They pull it terribly tightly, right at scalp level. As the hair grows out, so the weave grows out. So in a month's time, you have to go back and have it retightened and
you're
pulled down
having a
again.
traction effect on the only hair you have left,
You
which
have
is even worse.
traction alopecia, you have breakage, you have infection because it breaks the skin sometimes. It's absolutely appalling. I've seen some absolutely dreadful cases.
I must agree with you.
But I think you must be a little more expository in describing the hair implant, because it's a synthetic the material.
No one does it anymore. In fact,
it's,
the Attorney General has gone
Yes, that's
after that
correct.
fellow who was initially doing it. Because I had the unfortunate experience. I've treated myself over 10 patients, most of whom almost lost their scalp, because what they did was they took basically fish net wire. It was like if you want to catch a fish, they use the same type of material, putting it into the scalp, which is a foreign body, causing a foreign body reaction. They got infection. They had sloughing of the scalp. I had to do grafts. I had one man I was treating for over a year and a half. Fortunately, he responded beautifully, but a great time and effort and expense on his part.
Of course.
But the transplant is a good procedure
right, yes.
in properly selected cases.
That's right.
And if the man is aesthetic.
Yes.
Remember, as we all know, not all doctors are the same, not all trichologists are the same, not all as good as you are. And they have to really have a feel for the kind of work we do. We are in the beauty business, basically.
That's right. And interestingly, I supplied the first patient in England for a transplant to a man called Dr. Philip Lebon. And he had it done in 1961, and I saw him last time I was back in London, which was 10 days ago. That's 22 years later, and they were still there. He had them done up there, and they're still as perfect as ever. He'd lost hair from round them, but the transplants are still there, and they're very effective.
Yes.
But you must
Transplantation.
mention that scarring takes place very often. You get that cobblestone effect.
No, I beg to differ with you. In the properly done cases, the cobblestoning effect can be minimized, and if they're placed properly and in a very aesthetic way, you will really hardly notice it. Now, some patients get the problem by their own way they heal. They get perhaps a little hypertrophic scarring or perhaps keloidy. But if you're very aesthetic about it, I think that can be minimized at the very best. So, we discussed a lot tonight. We discussed nutrition and all the mechanical effects and being sure to choose the right parents and all the things
And
that...
also the right shampoos and conditioners.
Absolutely. That goes without saying. But I think we brought a lot of really good information to our audience. I think we're going to come back very soon, and maybe we'll have another whole symposium on hair again, different new advances. And I want to thank you so much for joining us. And I want to thank you at home for joining us too. And I think we've covered a lot of things for you, some more food for thought. And keep watching us, because we're back every week, Mondays and Wednesdays, 11:30 on Mondays, Wednesdays at 9:30. I want you to have a very good year. Here's looking at you. Good night. Good evening. I'm Dr. Louis Fetter, cosmetic surgeon and dermatologist practicing in New York. Welcome once again to Here's Looking at You, the weekly health and fashion and beauty and lifestyle show that we work on very hard to bring you all the latest information on all the things we just mentioned. Now, tonight we're going to discuss a very interesting subject: laser therapy, laser beams, all those science fiction type concepts that are conjured up in your minds. But we have with us tonight a very interesting guest, a prominent plastic surgeon on the staff at the Beth Israel Hospital, Dr. Lester Silver, who's in charge of the Pediatric Reconstructive Unit and in charge of the Laser Therapy Treatment Program. Dr. Silver, Lester, thank you so much for joining us.
It's my pleasure to be here, sir.
Tell me, what is a laser beam? What does laser mean?
Well, laser is an eponym, and what they did is they took the first letters of the words light amplification by the stimulated emission of radiation and made it LASER.
Right. As you know, I have an argon laser beam in the office, and I use it for a lot of my patients. So tonight we're going to discuss what you do in the hospital and what I might do in the hospital where I work or in the office that really can help patients and help people both cosmetically and on a reconstructive level. Now, we're going to get very basic, and then we're going to build up to perhaps some of the things that people at home can really find application for themselves and their friends. What do you think is the most useful application of the laser beam now?
Well, the laser beam has been around for many years, primarily originally in military use. It's more of a Johnny-come-lately in medicine, but it's used in many areas. Our colleagues in ophthalmology first started using it perhaps 25 years ago.
Mm-hmm.
The plastic
That was
surgery...
the detached retina, am I correct?
That's primarily in the area of retina work and glaucoma work, diabetic work, things of that sort. In plastic surgery, we've been using it for perhaps 12 or 14 years. And it should be generally known that there are several kinds of lasers.
Right.
Now, lasers are nothing more than light. And what that means is there should be no fear on the part of people that it has anything to do with X-rays or radiation.
Very often patients will say that, and there's a different kind of radiation. It's non-ionizing, which means not cancerogenic. And I always tell patients that, not to be concerned because it can't cause cancer.
Well, I think if people were to think and realize that when they check out of the supermarket, the package goes over a laser, or...
Industrial use is very, very big now. So the kinds that I see mostly used today in medicine, and you see, of course, are the YAG, and, of course, the CO2 laser and the argon laser. Now, I know in my practice we use the argon. I'm going to show some slides in a few minutes to the audience. We treat mostly vascular tumors and tattoos. Now, I know you use the CO2 also. And what are you using most of the CO2 meaning, of course, carbon dioxide laser, which is a different type of delivery and mechanism, but it does some of the same things that the argon beam does.
Yeah, I think it should be made clear that the differences in these type of lasers is the argon laser is more of a coagulating or a burning or a cooking laser, similar to what an electric needle used to do. The carbon dioxide laser is more of a cutting tool. It's almost like a hot scalpel, if you will.
Yeah.
So the carbon dioxide laser comes more into play when you remove tumors, or you have to do certain types of cutting, or you wish to use it as some ear, nose, and throat surgeons do to work around the vocal cords, polyps, things of that sort. The YAG laser, which stands for yttrium aluminum garnet, is a higher powered laser, and that generally has its uses in various intestinal work where they need high power for tumors and things of that sort. The argon, interestingly enough, is useful on the skin for colored lesions, primarily vascular lesions, because it happens to be of a blue-green color.
And in blood, it joins with it.
The red color will be absorbed preferentially by it.
You know, before I had the argon in the office, I used to do dermabrasion quite frequently for tattoos. And I found invariably they would scar. In the best case I'd get, it would not give me the result. Many of the patients were happy. For example, some gal's getting married and she has Steve on the right arm and she's marrying Joel. That is a problem, and it can give you major headaches. So the girls would come in to me, and men too. They'd often have tattoos and things of that sort, and we would dermabrate them, like on the arms, the legs, and it would scar. With the argon beam, I'm getting a much better result. Now, there are many ways we can treat it. It's not a foolproof method, and there will be some residual tumor left, tumor meaning the tattoo, but it will look much better than what they had before, and much less scarring, and of course, minimal pain, if any.
Yeah, well, I think the argon laser has a way of being a more specific, precise pinpoint technique in terms of the tattoo removal. It very often will not remove all of the pigment.
No.
You may have to go back, because interestingly enough, tattoos are put on the way children color. They put in the outline very heavy, and then they lighten in the middle.
Well, the worst kind of tattoo is like someone who would, for example, take a fall off a motorcycle and they get a traumatic tattoo. Or if someone is at home and they're a kid and their boyfriend puts a little heart on them, and that's the most difficult kind to treat, and I've treated them like that. We'll show one which is a professional tattoo, but I had a gal who had a tattoo of a heart, And it was very hard to do because I guess the fellow was trying to just practice his art form, and some parts were very deep and other parts were lighter, and that was the most difficult thing to remove.
Well, I think, in all fairness, the argon laser is certainly a good mode of therapy for tattoos. One of the problems is there is still a relatively high incidence of scarring. In some series, as high as perhaps 20 or 25% of the patients will get some irregularity. So I think people should generally know that there really is no method of quote-unquote removing a tattoo.
Not completely.
You may be able to make it lighter, or like a light scrape, if you will, but it tends to always leave some color and some texture abnormality.
Remember we discussed before, if we use the argon beam, for example, on a tattoo on the arm, sometimes I lightly curette it using a curette is an instrument like a round razor blade, and we go ahead and we often just lightly macerate the skin in addition to using the argon beam, and sometimes that gives you a nice result also. And also the application of different acids in addition to the argon beam, I have found also good to lighten them. Now, before we go on, let's give the audience an idea of what an argon laser beam can do and some of the indications for it, some before and after shots of patients that I've treated. Our first slide is a patient with a port wine stain, which is a tumor this man was born with, and there were very few things you could do for a patient like this until the era of the laser beam. Now, have a good look at this one, and you'll see what can be done with the use of the argon laser beam. And the second photo you're going to see is after several visits to our office with the treatment. I think it's a rather interesting result, good result, and more can be done. I mean, these are not pictures that are completely finished. The patients have to come back for further follow-up. It takes a lot of time. We have to first skin test them. Usually we use the argon laser beam behind the ear to see how the patient is going to respond to the laser beam, and we advise them about different pros and cons of the laser, and is the laser the most effective treatment for them. All right, now we're going to go to a second case. Now this is basically spider veins of the face. Now these can be caused by many causes. For example, people with Anglo-Saxon skin, very fair skin, people who are in the sun very, very frequently, sun damage, people who drink a lot. This is seen more commonly in. And I may go initially to the argon laser beam, but more often than not, I may try a little electrosurgery on the face, and if the little venule tends to recur, I may at that time go to the laser beam. Depends upon the clinical presentation. I don't say every patient is for this or every patient is for that. Again, it depends upon the doctor's expertise and training and his own personal way of taking care of these particular problems. Now look at the case, the slide following after the treatment. This was in one visit. And you can see that that lesion is gone, and I want to tell you that lesion is gone forever. Now, other lesions may come, but the one you saw that you saw before and now, there is no more. Now, the third case, this is a vascular tumor of the face known as a cavernous hemangioma. That's a long name for a highly vascular tumor, which is very often seen arising at childhood. And unless, of course, it impinges upon vital structures as the child is first developing, it is usually not touched, because many times you can treat it also with oral cortisone. In many cases can help decrease the size of these tumors. And as the child gets older, the lesion usually gets smaller. Now in this case, we use the argon again, and we used a little substance called ethoxysclerol into the lesion, which is a substance to cause some sclerosis or some sticking together of the vessels. And as you can see in the follow-up to this first slide, it's much, much smaller, and the family was very, very happy. It's a nice case. And the last case we're going to show you tonight, before you all go Betty-bye, is a case of a tattoo. Now this particular tattoo was done by a professional. And it just so happens that professionally done tattoo, as I mentioned, is easier to treat than a tattoo which is just done by your friend. Don't do tattoos at all, I think, but if you want to have it done by a professional, and perhaps you won't get sick. Now you're going to see the result afterwards, and the result is good. It could be better, and the things you can do afterwards. You'll notice a little bit of what we call ghosting. There's a little like an image of the initial tattoo from the first one. But the result is good, and the patient was very happy. All right, so we showed you those cases, and there are many other ones. This is just a few of the ones I've brought with me, but many other things can be helped with the use of the laser beam, as we're going to discuss further tonight. All right, so now, Dr. Silva, what do you think? What else can we tell our audience about the choice of laser beam?
Well, I'd like to say, going from tattoos to something else for a moment, the truth is where this is a method of treating tattoos, I don't think it's anything miraculous in that we have had other ways of treating tattoos, dermabrasion and whatnot. But I think the use of the argon laser for this port wine stain is really unique, because until that came along, we never had a good treatment.
Nothing.
And indeed, I think most people would agree that that is now the treatment of choice for port wine stains. It's a low degree of risk. The incidence of scarring for those is quite low, perhaps less than 5%. The changes, as you mentioned, are permanent up to the 12 or 14 years we've used it.
Painless?
It's painless, even though we do use some local anesthesia for these because there's a slight burning sensation. Of course, it should be known that these are all done as outpatients,
Yes.
Generally under local anesthesia. And overall, the results have been good. We have also have some idea now for which patients are better to treat than others. Perhaps you have some ideas from the ones you've treated in that regard.
You know, you have to be careful. I think every patient is, as we know, its own entity. And that's why I do skin test certain patients. Some patients who are very fair will heal well, and some patients who are dark will heal well, and just sometimes the opposite will occur. So I do try to do a test dose for a patient occasionally behind the ear. Now, in your hands, in very fair skin, do you like the use of the argon beam?
I think that overall I have found that the older the patient is within reason, and the darker the color is, the better they seem to do. And in that regard, we have been notably unsuccessful in treating young children because they tend to have very pinkish, lacy-looking areas, and they don't heal as well. So by and large, we will not start to test people until they're into their early teens. The reason that the darker ones work better is sort of the theory of more sardines packed into the can. The more blood vessels packed into that little area,
The more
greater
vascular it is, the
and
better,
it picks up
the better
more
it is.
energy, and it will fade more.
Now, what do you think about the possibility of doing some incision, like in some cosmetic surgery, like a facelift? People say, don't you do your incisions for your facelift or something with a CO2 laser? How do you talk to and answer your patients when they ask you that?
Well, I don't think that the laser at the moment is ready to supplant surgical scalpels. I think that the incisions we get from scalpels are fine. However, I think the audience should be aware of the fact that we're now beginning to see that the laser, in addition to being a thermal or a heat tool, probably has some effect on the way wounds heal.
And you mentioned maybe better healing, like with areas that, like a keloid, for example, which may be very recurrent. It may be better. Am I right?
Well, that's true. There's some very early work which tends to show that if you remove a keloid with a laser, usually a CO2 laser, that there seems to be less of an incidence of a recurrence of that. Exactly why, we're not sure, but the laser probably has some effect on how scar forms. At the moment, that's not proven and is somewhat of an anecdote based on each individual patient, but I think more work in the future will show that to be a tool for that.
But wouldn't you say, by and large, I know in my practice, I already have my answer, but in a hospital-based practice such as yours, wouldn't you say, by and large, most of the patients you've treated and their families are rather pleased with the effects of the laser?
There's no question about it, because the laser is an outpatient tool. It's relatively safe. It's financially reasonable to do it because, as most insurance carriers we have found, look upon this as a tumor, as you mentioned, so coverage is sometimes often provided.
Yes.
The insurance companies have come to realize that they could save a lot of money by not having a patient in the hospital, having general anesthesia to have this procedure done as an outpatient. And the discomfort is really relatively quite slight. The patients really...
That's such a very good point about that patients can come to an office. I mean, hospitals are fine for certain procedures, but I find that I can deliver health care to my patient, and I don't consider my office really an office anymore. I consider it more as a health care facility, because I have so many modalities there that I can take care of a patient in a matter of an hour. They may have to wait 5 or 6 hours in a hospital, even if they were inpatients, because it's such a backup and there's so many things that have to be done. But if a doctor has his own practice where he has to get the patient in and out, their time is as valuable as his, I can find that patients are happier, I'm happier, and the efficiency goes way up because I have all those things right there, and I know I just block out periods of time. For example, for the argon laser beam, I'll block out half an hour or 45 minutes. Patient's there, the machine's turned on, boom, boom, boom. The patient can go right home without any problem because there's no pain. After the local anesthetic wears off, I can give them some mild analgesia. They love it.
I think there's no question but that argon lasering for most of these blood vessel things we've been talking about can be done as an outpatient, whether it's your office, which is quite efficient, or hospital outpatient facilities.
Either or.
You know, that's the convenience of the patient.
But they're coming to you as an outpatient also, which is very important.
That's true. The only people we will occasionally hospitalize is somebody who has an absolutely huge lesion that will take hours to treat, where it's just not fair to have the patient lie there for many hours on the local.
Yes.
Or occasionally we'll have a patient who has a medical problem or is extremely nervous, and we have on rare occasion had a patient in the hospital for general anesthesia. Of course, when you get away from argon laser and you start to talk about CO2 and YAG laser for less cosmetic, more medical indications, such as excising large tumors or using it inside the body in the vocal cords or in the stomach.
Or surgery or
things of that sort. Those are, of course, inpatient regular operation procedures where the laser is being used just as another tool. Now, I think we should comment, to be fair, the laser does a lot, but there are certain things that I think it does not do.
Like?
Well, for instance, we've heard about laser facelifts from Europe, and the truth of the matter is there is no basis in fact for what a laser will do. And I'm sure that in years to come you'll hear about laser for everything from fallen arches to psoriasis.
I've heard about these things when I was in Europe, in fact. I was in France, and I was visiting the L'Hôpital de Saint-Louis, which is a well-known cosmetic hospital. And I ran into a doctor there who was using the French laser beam. So I met her and we spoke, and she said, "Don't you want to be the first doctor in America to use the French laser beam?" And I said, "Well, what is it?" And she gave me a long thing, but I didn't understand it. She showed me diagrams, and I said, "Gee, I still don't understand it." So she showed me a few patients, and she was taking this beam going up and down across their face, and I said, "Well, what's happening?" She said, "Well, they're much less red." And I must tell you, I spoke to the patients, I saw the photographs, I thought it was like the Emperor's new clothes. So I decided at that time I didn't want the French laser, but I'll stick with the argon laser here in America. But don't you find that people think that the laser can do everything?
There's absolutely no question about it. Whatever illness people have, they think that the laser is an answer. I think, in truth, the laser is a tool. The argon laser works on colored areas because of its pigmentation. The CO2 laser is a new cutting tool. The YAG laser is also a powerful cutting tool. It's being used in many areas of medicine and surgery. These areas are in their youth, and we will expand on them. And I think it's in its infancy, but there's no question that it has given us a very, very great amount of assistance in things we couldn't treat before.
Right. But let the audience know, though, the scarring that can be seen, which isn't that frequent, how often do you think you find it with your argon?
In my hands, scarring has been less than 5%. Now, there are different techniques that have been used with the argon laser, and that is that some people tend to use a higher dose than others. The truth is, as with taking 2 aspirins for a headache, the whole bottle wouldn't be better. The less...
I always find less is better.
The least amount of laser energy would work.
I find that even when I use the laser in the office, I use less than a watt.
Well,
almost everything.
that's the reason why the test spot's important. It lets us know.
Actually,
the test spot is the only place in medicine that I know of where you can do an area and a patient can actually see what's about to happen to them in terms of what their future holds.
And if they don't like it, you can always call them from Australia, right?
And laser treatment can be started or stopped at any time.
Yes.
It can fit into people's schedules for going to school or taking vacations. The one thing that I do always point out to the patients is they must really be careful about not getting excess sun for quite a long period of time.
At least 6 months, I tell them. And I make them wear a sunblock also on top
Absolutely.
of that. Now, you know, I think it's also important that our audience recognize that there are certain doctors who have it, either in the office or the hospital. We've all had special postgraduate courses in laser therapy. Not just every doctor who wants to buy a laser beam can just use a laser beam, because the companies that manufacture them more or less demand, and we ourselves demand, that we have special training in the use of these things. And I think that's important to know.
Indeed. Most institutions, indeed, even have a laser committee where they try to control the people who are using the lasers.
Do you anticipate any things that perhaps are not treated today, which may be in the future useful for laser therapy?
Yes, I think so. For instance, there's a lot of laser uses under the microscope that are still experimental, but lasers, the CO2 laser, in very, very minuscule doses, focused to a tiny beam, will be able to hook together very, very tiny blood vessels that now have to be sutured, and other tiny, tiny structures. This is still experimental.
Microsurgical laser therapy.
Microsurgical laser therapy.
That's fabulous.
And other areas of neurosurgery and other places where there are inaccessible areas of the body that you just can't get to, the laser can be beamed through mirrors and various tubes to get there. For instance, the internists are now able to save some people with bleeding ulcer surgery by using a laser beam into the stomach to coagulate bleeding.
One of my friends in California wants to treat severe, what we call vasomotor rhinitis, which is a severe allergic condition. And what he's doing now, he goes into the nose. In fact, he did it on his own daughter. That's why I knew it was a good idea, because I have a little problem with allergies myself. He goes in through the nose, and he cuts off part of what's called the turbinates, which are a large membranous tissue, which also gets rather inflamed and swollen when one has allergic problems. And he actually trimmed off part of these turbinates on his child, and he's done quite a few other patients, and he plans to write it up. And I think that's another indication for the use of the laser, which might be fabulous.
The other thing is I think the audience should know that the laser is not a mutually exclusive treatment. The laser can be used with other treatments. For instance, some areas can have a surgical procedure, and you can touch up red areas with the laser. Or you mentioned, I believe, a dermatologic condition of acne rosacea, where the redness can be treated with the laser and the rest could be treated with other areas.
Perhaps a dermabrasion for the severe scarring and depressions, and perhaps a chemical peel following that. And then for the residual redness, we can use the laser beam, and it's very effective.
The other question people frequently ask is if they have a red mark or stain and it's faded only somewhat, can you laser it again? And indeed, we have relasered areas. If we wait for 6 months or a year until they're fully healed, sometimes then you can relaser and get some deeper blood vessels.
Isn't that your biggest problem? The patients don't want to wait 6 months or a year? They want it done yesterday?
That's true. Everybody always wants everything done yesterday.
Right.
But indeed, that can be done. I think the other thing that's important to point out is in the years that this mode of therapy has been done, the changes have been permanent. In other words, if you fade an area out 5 years ago, later it won't come back.
Right.
And also the so-called skin appendages, such as hair follicles and sweat glands, are not destroyed.
They're not affected, that's correct. Nice thing is, once you treat a patient with a laser beam, other venules or other areas may come out later, but the ones you initially treated, they are gone forever.
That's true. There's another area I've had a problem with. People often ask about treating little venules and vessels and spiders on the leg. Now, I have found in my hands that the argon laser has not been good for those. What is your
I would agree with you. I've tried it. It does not work. And I do a lot of vein work on the legs because they're rather unsightly. I do them for the larger vessels also, but mainly, as you know, I have a cosmetic practice. And I use the substance called ethoxysclerol, and I've done literally over 1,000 patients. I have never had scarring, discomfort, allergy, major pain. It's the kind of substance that is literally foolproof. I don't use more than 3 cc's at a time.
This is an injection into the vessel.
I inject it with very fine magnifiers right into the venule. With a little bit of the substance, I press close on the area, and the substance that I inject causes a sticking together of the vessel walls, and over a period of time, it may not happen after just one injection. You may have to go back 2 or 3 times, but the vessel wall eventually just collapses and sticks together, and there's no problem with circulation, mind you. These are just superficial venules, which have nothing to do with the general circulation, and they just go away, and the patient is fine cosmetically, and they can go on the beach again.
And you don't find that those areas come back again?
Not really. Occasionally, areas around them may come back.
New areas will form?
Possibly.
Yeah,
Depends on the patient's vasculature.
That's the problem with the legs. They're standing and they're under a head of pressure,
exactly.
so they
and
tend to
pregnancy
find
can
new
affect
roots.
that.
Absolutely.
And exercise. But the main thing, of course, as we both know, is that the familial, the heredity, plays the major role in that.
That's true. I think another thing of interest is it's unfortunate that the good Lord saw fit to give people blemishes and red marks on the face, but of great note is that the results on the face are far superior to treating these areas anywhere else on the body. Now, obviously, there's not too much of a reason to treat it on your back or your thigh, but we have had
Unless you're a back model, of course.
Well, we have had some patients who had it down on their neck area, and in order to help them to wear a particularly different style, we would treat an area of the upper chest. But obviously, when you have a huge area, it becomes prohibitive to treat it in terms of time and the amount of effort that goes into it, and the fact that the patient would have to have dozens and dozens of treatments.
Yeah, the patient has to recognize that the use of these procedures, either like the leg veins or the laser beam, the patient may have to come back several times. Now, let me ask you another question. I know you're not mainly in cosmetic, although you do some. What can you tell us that might be of interest to the audience that you're seeing a lot of now that might be rather a new technique that you may use in your hands?
Well, I think there's 2 things that should be mentioned. One of which is there's now more information known about, and more people are seeking reconstructions of their breasts after mastectomies, which is something years ago that was not done, it was not spoken about.
Right.
A lot of the surgeons felt that, well, your cancer's cured, you should live that way. and now no longer is this happening.
That nice new Radovin skin expander, which is very good for that too. It stretches the skin.
Well, there are several ways to do it, but basically it ranges from using some type of prosthesis, and these are usually used under the muscle because nowadays most surgeons do not do a radical procedure.
Right.
And if it turns out you have had a radical procedure or radiation, there are muscles from elsewhere in the body. Namely,
What's the second thing you want to mention? Because we have about 15 seconds to go before we get to our sleep time.
well, the other thing is liposuction.
Oh boy, you know, I do a lot of that. We love that. We suck the fat out.
Well, I think you should say a few words about that.
It works.
Because I'm not an expert on
I'll
that.
tell you, it really works. It's a good procedure for the body. Watch us again. We have numerous shows on that. But Dr. Silver, I want to thank you for joining us, and I want to thank you at home for watching us again. I hope we brought you some very interesting information. Go to sleep, sleep well. Come back next Monday. Watch us again. Bye-bye. Good evening. I'm Dr. Louis Fetter, cosmetic surgeon and dermatologist practicing in New York. Welcome once again to Here's Looking at You. This is the weekly show with you in mind, discussing fashion and beauty and cosmetic surgery and lifestyles. Tonight we're going to discuss the wild and wonderful, exciting business, and it's a business now, of modeling. Everyone thinks it's so glamorous.